Hello and welcome to Pisgah Health Today. My name is Angela Owen and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Dr. Richard Hudspeth. He is the CEO of Blue Ridge Community Health Services. Welcome to our program today, Dr. Hudspeth.
Thank you. Pleasure to be with you today.
Dr. Hudspeth was named BRCHS CMO, that's a lot of letters to put together, in July 2015, then transitioned to the role of CEO in April 2016. Prior to this, he served as Medical Director of Community Care of Western North Carolina and as faculty with the Mayhec-Hendersonville Family Medicine Residency Program. Dr. Hudspeth earned his medical doctorate from the University of North Carolina School of Medicine and is board certified in family medicine. He completed his family medicine residency via the International Health Track at the University of Cincinnati and completed an obstetrics fellowship, get my language out here, at the University of Utah. He has volunteered on multiple international medical assignments, including in 2015 during the Ebola pandemic in West Africa, as well as in Haiti, Honduras, and Venezuela. He is a member of the North Carolina and American Academy of Family Physicians. Welcome again to our program, and forgive me for butchering some of those languages and names here along the way.
You did great.
Well, thank you. And why don't you start by telling us a little bit about Blue Ridge Community Health Services?
Well, Blue Ridge is a community health center, and as many of you may know, community health centers are a public-private partnership with the federal government, and there are roughly 4,000 different community health center sites across the United States. North Carolina has about 40 to 45 community health centers. Blue Ridge, as one of those, was initially started in 1963 by a public health nurse who was interested in providing better care for the migrant population. And that's how Blue Ridge got its start. We still hold near and dear to our heart that particular population and continue to serve our agricultural seasonal workers throughout our history. In the mid-'80s, we became a community health center and got that designation through the federal government. Since then, we started in Henderson County, but have now expanded to 8 and soon to be 9 counties in Western North Carolina. We have a variety of services. Clearly, our main focus is just providing general primary medical care to the citizens of Western North Carolina. With that said, we have a number of programs that go along with that in order to serve all of their needs. For example, we have an extensive behavioral health group within our organization. We have some specialists as well, pediatric specialists, as well as we have a neurologist on staff, a pediatric neurologist, and psychiatry as well. In addition to that, we do dental care. So we have 4 dental sites within Western North Carolina, and we have 1 mobile dental bus as well. We have 3 pharmacies where we're able to provide low-cost medications for patients, again, through a public-private partnership with the federal government and a program recognized called 340B program. We also do school-based health care. So we have providers, either medical and or behavioral health providers located in schools to help make sure that our kids are well taken care of and can provide care right on site, whether it's normal vaccination care or sick care if a child becomes sick during their school day. And we discovered that that's really enabled parents to continue working and keep kids in school and get them back in the classroom as quickly as possible. We also have nutrition services as well. So a variety of different services that we provide. In addition, we partner with a lot of different groups, for example, Mayhec, and we have what's called the Teaching Health Center program. So we train future family physicians in Western North Carolina, and that's been a great boon to North Carolina in the sense that we can not only train them, but train them in a community health center environment, and then encourage them to stay in Western North Carolina and give them jobs in Western North Carolina. With that comes what I like to term kind of the back to the future of that family doctor that people think of. If you're old enough to remember the
Oh,
Marcus
yes.
Welby series, and so our doctors are not only seeing folks in sort of your typical outpatient world, but they're also providing care in the hospital. So they're seeing patients delivering babies, taking care of kids, taking care of adults as well in the hospital and doing that. And we do that in several counties in Western North Carolina.
It is incredible to hear you list all of those different services, touching on really the whole life of wellness for these families and individuals, and to think about the history starting way back in 1963, with the target being really taking care of the migrant population. So, wow,
Absolutely.
congratulations to you and the others for keeping the longevity and the expansion and the continued growth of those services along the way.
Well,
Dr.
thank
Hudspeth,
you.
of
I was just
course.
going to, and I'm sure some of this we'll be having a discussion about, but it isn't possible without the partnerships that we have, including with, Pisgah Health Foundation and others. As I said, we are a public-private partnership. We do work with the federal government as a community health center, but we also work within donors within our local areas, state, local government, county governments, as well as foundations to provide support for all of the work that we're doing. So without them, we couldn't do what we're doing.
Well, those donors are certainly demonstrating that they care about the health and well-being of Western North Carolina residents. How specifically has the grant or grants that you received from Pisgah Health Foundation helped you in providing those services?
Well, one aspect that we have focused on recently within the past few years is behavioral health services, and in particular, behavioral health services related to folks that may have a substance use disorder. And so we jumped on pretty early to try and figure out how we can serve those patients and try and help solve some of the issues that we see playing out in the press in terms of um, misuse of opioid, narcotic medications, and things like that. So one of the things that the Pisgah Health Foundation has helped us with tremendously is being able to support those services for patients that may not have the ability to actually, afford for care themselves, whether it's their medications, whether it's the therapy that goes around that, whether it's the visit to the provider in order to get specific treatment medications to help with that addiction. So that's been very valuable. We know, and we've seen, and I mean, many of us have seen the statistics and around how extensive that some of those behaviors are. And it hits home pretty much with everybody. Everybody now knows somebody who was affected by either a child, a parent, or someone else affected by that misuse of substances. So that's been a great area of focus of ours, and we've appreciated the help that Pisgah Health Foundation. And we consider it really, and if we can get people healthy in that regard, get them functional back into work, avoiding the criminal justice system, avoiding having their kids taken away and having the foster care program, it pays tremendous dividends down the road. So it's not just money going to help Blue Ridge do this, but it's also making an investment in our future to try and reduce all those other social services costs that go along with, again, illegal use of substances.
That's really important what you're highlighting. And I do think that helping the rest of the community around recognize this investment does touch on so many different things. And you just listed, I'm sure there are many more even from behind what you just listed, but the social services and the school system, et cetera, and so forth along the way. That's really incredible. And have you seen through this year or last year with COVID-19, have you seen any changes in the kinds of things that people are needing to come in and be seen for, or services that you're providing overall?
Well, as we all have lived through this pandemic and we hear tales throughout the country and the world, we've realized that the troubles that people have had just become exacerbated by something of a pandemic. So we've seen things like suicide increase, we've seen drug use increase, we've seen domestic violence increase, we've seen lack of access to healthcare, providing or negating our ability to take care of folks, getting in for preventative care for kids or adults, et cetera. So this pandemic has really highlighted the need for the services that we do. And as people lose their jobs as a community health center, our mission is to provide quality health care that's affordable and accessible for all, regardless of their ability to pay. And so as people lose their jobs and have other issues that they're dealing with, it's more important for us to be there. We converted to telehealth, which is, an electronic means of doing patient visits. And it's been very valuable for our behavioral health patients in particular, for them to continue therapy as well as get their medications, as I've described before, for certain individuals, in order to continue that progress that they've made thus far, and not to just have that come to a screeching halt and then end up in a worse way when we finally do get out of this pandemic.
Well, it's also brought some measure of convenience that I'm sure has also helped, hopefully, with keeping some continuity there for folks in those services along the way. Dr. Hudspeth, what else would be important for our viewers to know about Blue Ridge Community Health Services? How can they get involved? How can they support? What else would be important for them to understand?
Well, I wanted to just mention one other thing. You'd mentioned COVID, and we talked about how we've tried to deal with that. But we feel strongly about our mission as a community health center. And so even though COVID and some of the things related to COVID wasn't really part of our practice beforehand, our organization in Western North Carolina has done over 22 to 23,000 tests for COVID in this past sort of 9 months. And taking care of folks that test positive, but providing mass testing sites, including some in Transylvania County, as well as Henderson and other centers in Polk as well. So throughout Western North Carolina. And now we're transitioning to vaccinations. And as we're just gearing up to do that, clearly it's going to be a big effort. The United States has never had to do a mass vaccination like we're attempting to do in such a short period of time. We can deliver flu shots to people that want them over a period of 3 months, but to try and get every single American who wants a vaccine for COVID, that takes a lot of community collaboration. And so I think what I would ask is get involved in those organizations like Blue Ridge, or volunteer to help us put some of these mass vaccination events together. Those can be very helpful because, we still need folks, even though you may not have medical training, we still need folks kind of directing traffic and helping us get scheduled, do all sorts of things. So those are positive ways to reach out to us. I think we have a website. You can look up brchs.com, and there are many things on there about how to get involved, how to apply for jobs, how to potentially volunteer some of our folks, and how to get in touch with them and their individual either phone numbers or email addresses. I think the other piece is, we do rely on donations for our organization. We are a nonprofit organization. And as that public-private partnership, we rely on folks to continue to help. And any little bit can help. It's amazing how little someone can contribute and make a big impact on someone's life by being able to afford a medicine, or being able to see a physician for an appointment, or have that behavioral health appointment, or get their kid to a dentist. All of those things make a difference.
Lots of different ways that anyone can get involved and support along the way. Well, Dr. Hudspeth, thank you so much for being part of the program today. And on behalf of the Board of Directors of Pisgah Health Foundation, I want to say thank you to you and the rest of the staff and all of those who volunteer and support the work that you're doing at Blue Ridge Community Health Center. And it's just a tremendous service and multiple ways that you're providing to Western North Carolina. So thank you so very much, and for your time today here on Pisgah Health Today.
Thank you. You're welcome.
We also want to thank Wildflower Media for their creative and technical support, as well as the board of directors, the staff, and the Physicians Roundtable connected to the Pisgah Health Foundation. If you like this story you heard today and you would like to support more stories like this, please go to pisgahhealthinsider.org and join the movement. Until we see you on the next Pisgah Health Today, stay well and be well.